during different seasons, like, or sometimes during the summer it's not recommended to treat them because it's too warm. All right, so these systems are very safe, so you can actually use it all the time. So before I start, I just would like to show some of the before after pictures with you, to share with you that actually the results are quite remarkable, and it's also quite fast to see the difference. Okay, so this picture is just 6 weeks after the second sessions, okay, of treatments, and you can see that the reductions of hair are very promising and very good here. This is on the back, so this is also 6 weeks only after 2 sessions. Okay, this is on the leg. All right, and this is also 6 weeks after second sessions. So you can see most of the pictures here is right. Most of the times you can see very good result even after the second sessions already. All right, so this is on the armpit, the underarm, and this is on the chest. But this gentleman here is a bit hairy. So this picture is 8 weeks after the 6 sessions, but the reduction is really good. You can see that almost all the hair, I can say, is gone. All right, and this is bikini line. So this is only after 1 sessions. So you can see the reduction is really good. Okay, this is another one on the back. So this is after 5 sessions. And this is another one on the chest. Okay, so that is some of the pictures that I would like to share with you. Okay, and so this is some of the things that I'm going to go through today. All right, and first is the biology of the hair removal, basically. I mean, our skin structures. So to understand how it works, basically, we have to understand also where's the hair and how it's actually target the hair. And maybe some of you already know, but I would just like to, have a refresher for you lah. So at least, you can recall it, okay? So you can see that this is the hair structures, all right? And what we are doing during the hair laser hair removal treatment is that we didn't want to target the hair shaft on top. So what we want to achieve at the end of the day is actually targeting the hair bulb and roots, okay, at the dermis area here, okay? So basically by targeting the hair bulb, we are trying to destroy or even trying to inhibit the growth of the hair bulbs, okay, at the roots here, okay? And by destroying it, hopefully is that it will have lesser hair in terms of quantity. And even if there is any hair grow back, it will become so weak that the hair will become finer. Okay, so this is a histology of the hair structure itself. So it's contained of a shaft, okay, and then the follicles, and then you can see there is a bulb and the papilla there, okay. So in this hair bulb, you can actually find that there is a lot of melanin in them, okay? And this melanin is actually created by a cell called melanocyte, which give color to our hair, okay? So basically our hair color is determined by this melanin, okay? And actually the target that we want during laser hair removal is the melanin in this hair bulb, okay? So let's say if your patients comes with gray hair, white hair, or very light hair color like blonde, then actually it's kind of tough to treat them because all these hair are lack of melanin, okay? So the darker the hair, basically the more melanin that has in the hair bulb. But when the hair getting lighter and lighter, actually there's less melanin. So when there's less melanin, right, what will happen is that even when we shine or when we shoot the laser into the hair bulb, there is no reaction from the hair follicle because the hair won't be, there's no melanin to basically absorb the light. Yeah, so you can't destroy, let's say if there's no melanin in them. So make sure that your patients are not coming in with gray hair or maybe even like, golden blonde hair or even white hair, because these are not going to respond to the lasers. All right. And understanding the hair growth cycle is very important as well, because actually we can only target the hair when they are at the anagen phase. When they are at the catagen phase, where we call it the transition phase, or even when they are at the resting stage, basically there are not much melanins, okay, that are intact in the hair bulb. All right, therefore they aren't able to destroy the bulb even when you shine the lasers on it. Okay, so and these cycles usually will repeat, and the whole cycle durations will depend on which area that you are treating. For example, if you are treating on the face, this cycle are relatively short. Usually it will take less than a month to complete, from anagen to catagen to telogen and back to anagen. However, let's say if you are treating on the body, especially on the leg, okay, the lower limb, usually the whole cycle takes quite long. It takes at least 2 to 3 months for the hair to go from anagen to catagen to telogen and back to anagen again. So, and because you can only target the hair when they are at the anagen phase, so sometimes when if you treat the patient too soon, for example, let's say if you're treating on the leg, okay, and because once you treat it, we expect that most of the hair at the anagen phase are being destroyed already. So we have to wait for those hair at the catagen and telogen phase to go back to the anagen phase. However, because it takes quite long time for the hairs, okay, to move from catagen to telogen and to anagens, if you treat too soon, probably, let's say, like if you treat them under 2 weeks or even 3 weeks or even under a month, okay, most of the hair might not back to the anagen stage yet. They are probably still at catagen and telogen stage. So therefore, you might not get a very remarkable result, because when the hair is at catagen or telogen phase, they can't absorb the light properly, okay? And most of the time, they don't react well to the lasers. So therefore, understanding these hair growth cycles and also understanding the cycle for each areas, okay, is quite important in order for us to get a very good result, okay? And of course, some of you might ask, how do I make sure that all the hair is at anagen phase? Basically, I will say we can't uh, make sure that all the hair will be at anagen phase, because our hair will be at different stage at the same time at one area, okay? So, but what we can do is we can try to capture most of the hair at the anagen phase at one time by following the cycle, okay? So let's say if you have complete the treatments, okay? For example, on the face this month, maybe like today on the 22nd of January. So by right, you should repeat it not lesser than 1 month, okay? But let's say if you repeat it just within 2 weeks, then probably most of the hair are still not at the anagen phase. So therefore, you can't get good results. But let's say if you repeat 1 month after, most of the hair are probably at anagen. But there are some hair still might be at the catagen or telogen. So this is also why you need to educate your patients, why we need to repeat the sessions, okay? Why usually hair removal require a few sessions and not just one sessions, is because we are not able to capture the hair at the same stage at the same time. So you need to wait, okay, for it to complete the cycle every time, okay, in order for us to capture most of the hair. So basically, this is nothing to do with the system that you are using. This is more to do with the cycle of the hair. So sometimes patients, they can't understand. They say like, oh, why some center tell me only 1 session or 2 sessions? It's kind of impossible, because our hair won't be at the same cycle or same stage at the same time. All right. So if there are any centers that telling them, oh, 1 time and I can get rid of all your hair, then probably, yeah, they are not telling the truth. Okay. And light absorptions. Okay, so using the right lasers to target the melanin is also very important, because we know that melanin in the hair bulb are the one that we want to target and destroy. So we need to get a laser that has very good absorption with the melanin. So in the market, there are a few typical wavelength for hair removal, like 755, 810 nanometer, and also 1064 nanometers. Okay, so these are a few very common lasers found in the market that can treat hair removal. But today, I'm going to specifically talk about the 810 nanometer wavelength, okay, because this is what we are using in the Alma Remove. And 810 nanometer is actually diode lasers, okay, while 755 is Alexandrite and 1064 is Nd:YAG. Okay, so now we go into the Alma Beauty Remove. So basically what great about Alma Beauty Remove is that we have three technologies combined in the same system, okay? So we call it the SHR, where this is a very, I would say, latest or a very new technologies, okay, in diode lasers. And we are also using a in-motion technique where this can help to make the treatment much more faster and also easy to operate, okay? And we have this glacial cooling technology where it can help to give soothing to the patients during the treatments and also reduce any discomfort to the patient at the same time, okay? And this cooling also actually helps to protect the skin from being burned during the treatments, okay? So this results in much more high efficacy and pain-free treatments, and of course, it gives us superior results. All right, so what this SHR about, okay? Basically, with the SHR technologies, we are able to cover almost all skins and all hair types, okay? Why I say almost? Because there are still some skin types in reality that we don't highly recommend to treat because they are still a risk of burning them. But of course, our Alma Beauty Remove already obtained FDA approval for all skin types and also all hair types, okay? So with the SHR technology, basically you are able to cover hair from very fine to very thick structures, okay? So this including what can be treated with the IPL, with the Ruby, with the LX, and even with the Nd:YAG lasers. So this is how versatile is our Alma Beauty Remove, okay? And of course, from light skin to dark skins as well. So what is this technologies about, okay? Basically, it gives a very gradual heating, okay, or we call a heat build up, okay, and it heat the dermis to a temperature slowly that effectively damage the hair follicles, okay. So instead of using a very high power like some lasers is using, which can easily damage the skin, what we do here is that we do not want to give one single pulse at very high power, okay? Because especially if you are treating very dark skin, it's kind of dangerous. So this heat buildup will let the skin kind of like get used to the heat, okay? And it will slowly tolerate to the heat so that once the heat is strong and it's sufficient or get built up enough, then it will still be able to target the hair follicles, but without damaging the surrounding area, okay? And at the same time, your patient will feel much more comfortable because instead of, just giving one strong pulse, they are able to adapt to the heat. So they can slowly get used to the whole treatments without like a sudden shock, okay, from the trigger of the lasers. And we also have a technique where we call it in-motion technique, okay? It's a pain-free movement where the applicators is basically move repeatedly over the treatment area, okay? So that means on the same areas, you will have to keep on move the handpiece around it over and over again, okay? Until you collect or until you build up the heat sufficient enough, okay, to damage the follicles. And no worried about when to stop the treatment, like, oh, do I have to calculate like when is the heat build up enough, or do I have to measure the temperature? So basically you don't have to do that because the systems will somehow already calculate for you, okay, how long you need to move the applicator around one area, okay, and how much energy you need to deliver to the area. So you can tell your patients, basically this is a very smart system, okay? Even a dummy, okay, anyone has not really used the system before can easily just, pick up the systems and with very, very little learning curve, they can easily learn how to use the systems, okay? Therefore, even clinic themselves also no need to worry about the manpower turnover, because we understand sometimes the clinic might have, staff coming in and, leaving the clinics, so, and you probably need to retrain them again and again and again. So it's going to be very hectic to the clinics, okay? So with the Alma Beauty Remove, basically the learning curve is very, very short. In fact, we will say usually by one sessions of training, they are able to pick up all the skills. Okay, and last but not least, the glacial technology. So like I mentioned earlier, this is a cooling systems where it cool down the skin surface during the treatments, okay, so that it gives more comfort to the patient, and it also helps to minimize any superficial burn. So the tip of the cooling is actually made of sapphire, all right, and it's sapphire actually is a medium which is a kind of solid, okay, it's very solid, it's not spoiled easily, all right, and it's very very efficient in terms of delivering the coldness, okay, and it's kind of cold, it can reach around -3 degrees Celsius. So with this low temperature, it's really more than sufficient actually to protect the skins, okay, and you don't have to use like the traditional way where you use a cold pack, or maybe even a cold air where you have to buy another cold air systems, which gonna cost you more, or even sometimes you need topical anesthesias to give more comfort to the patient. So all these are not necessary, okay? And of course, your patients or your clients also can go back to their normal activities immediately after the treatments. So like we mentioned earlier, we have a lot of clinical studies to actually help us to back up our statement that saying this is a safe technology for all skin type, okay? So if you require all this paper, please feel free to let us know so we can actually provide them to you, okay? All right, and of course, under our studies, these are some of the things that we show what is actually happening during the hair removal treatments. So here we are trying to show you what happened to the hair follicles, okay, when we deliver our diode lasers with the Alma Beauty Remove. Okay, so that means you only need one system for all skin type, and you can use it all year round, okay? So again, this is a summary of what the systems is, the specifications. So we are using the 8100 nanometer diode lasers, okay? And we have actually more than 8 years already, because this presentation is a few years back, okay? So actually it's more than 8 years of clinically proven efficacy, okay? It's a very portable system. Like you can see here, right? Actually, these systems are, you can actually put it, it's a tabletop system. You can put it on a cart, or you can even put it on the tables, okay? And it doesn't require a lot of space, okay, for your clinic, okay? And but of course, beside the SHR mode, actually we do have other modes as well. So if you prefer to treat some area with only one strong pulse or stacking pulse, we also have what we call the stack or HR mode, okay? And what good is that we do not have any consumables, okay? So basically there's not much of operating costs. All right, so this is the card that I mentioned, okay? And you can easily just place the system on the card. And again, these are some of the, I would say, uniqueness of the Alma Beauty Remove. Okay, and we have a very compact applicators, okay? Which means that the handpieces are not big. Okay, that's what important. It's not like IPL's IPL light system where usually the handpieces are relatively large, okay, because the crystals, the size are usually kind of big, all right. But in the Alma Beauty Remove, it's very easy to use for the clinics because it's very compact, it's very easy to be handled. Even though the operator is a lady like me, okay, with small hand, you won't feel tired even if you treat like, maybe 6 or 7 or even 8 patients a day, okay? So it's very lightweight, okay? And it's also very comfortable for your patients as well, because since the applicators are not very large, so it doesn't admit too much energy at the same time. So this is how we actually treat the patients, but I'm not going to go through very details because just now I think you have seen the video. So basically we just have to draw a grid on the treatment area, and of course this area of grid are depending on how much energy that you are using. Of course, let's say if you are using a higher energy, you can always draw a bigger grid so you can complete faster as well. And even in the system interface itself, you can actually choose the grid size. So for example, if you have a patient coming in with a very big chest, or big back, instead of 150, actually you can draw even a larger grid, okay? And the system is very smart. So the systems will eventually help you to calculate how much of energies that you have to deliver, and also how much time you need if you are treating a bigger area, okay? And you just have to fix the fluent according to the skin type that you are treating, and also of course taking into consideration the hair condition as well. But other than that, like I say, basically the operator doesn't really need much skill in order to operate this system. So they just have to choose the fluence and determine the grid size, and the systems will basically calculate, okay, the durations that you need for that area and the energies that you have to achieve. Okay, so all the operators need to do is just put some gel on the patients and start gliding on the areas until they finish up the duration that is shown on the screen. In fact, they don't have to calculate also, because why? The systems will also automatically stop when it reach 0 seconds. Okay, that means the area is completed. Okay, so these are some of the guidelines that comes with the systems. All right, so it's very easy. We don't leave you alone, guessing what to use. So we always show you or guide you on what are the fluents that's suitable for what skin type. Okay, so this is our standard grid size. But like I say again, if you want to treat a bigger area, actually you can also change it on the system interface itself. All right. So these are the recommended interval. Like I mentioned, because the face usually has a shorter hair cycle, so you can retreat within 4 to 6 weeks. But for the body, usually the cycle is longer. So I guess if it's possible, it's better to treat them within 6 to 8 weeks, okay? Then you will get a better results. But however, I do understand that from business point of view, sometimes you do not want to wait too long, okay? Because you start to lose patients, and your patients might think also, wow, it's gonna take like a year for me to complete the whole treatment. It's so long, okay? So, but try to at least space a minimum 6 weeks, okay, for the body, or else the result might not be that good, I would say, okay? And the recommended number of sessions varies depending on which area, how's the coarseness of the hair and the skin type as well. But typically, we will need around 6 to 10 sessions, okay? But darker skin type, like skin type 4, 5, or even 6, but 6, actually, we don't highly recommend to treat. You might need about 10, because these are kind of tough to treat, okay? And of course, the finer the hair also usually the tougher to treat. So you might need more sessions also for fine hair, while coarse hair usually reacts very well. So you probably need lesser session for coarse hair. Same goes to the hair color. If you come in with a very dark hair color, like black, it's usually very fast to achieve result. But let's say if you have patients coming in with light brown, or maybe even like red hair, all this, then it's gonna take more sessions. So the number of sessions really depends on what kind of hair conditions they have. All right, and like I mentioned earlier, beside the SHR mode, we also have what we call the SHR stack, okay? So, but the SHR stack, instead of using gliding, I think we have one video earlier to show you the SHR stack when the operator is treating the face of the male patient just now, okay? That one we are using stacking. So meaning that we don't glide around the skin, but we are treating one by one area, okay? But just that on each area, instead of giving one strong pulse, what we do here is that we deliver a few pulses, okay, of low fluence. So we are still accumulating energy, okay, at one area. But instead of gliding, okay, which can treat much bigger area, SHR stack is mainly to treat a smaller area. For example, if you are treating on the hair, on the face, or maybe if you want to touch up certain area, like, oh, you miss the area and you only have hair on one area, then you do not want to waste your time, to glide over 150 cm square or 300 cm squared, okay? So these are more for when they come back for touching up on certain area only. Then you can just do on few small areas, all right? So this is for SHR specs. And again, same, we also have the protocol for you to guide you on the treatments, okay? So like I say, this is mainly for face or smaller areas. All right, and finally the HR mode or the HR interface. So this is like the conventional diode lasers where usually we just give one strong pulse at one time and usually only one shot, okay, per area. So you can see the fluence that we use are relatively high. So usually we rarely use this HR mode unless if you have very challenging or tough cases, okay, or even some small areas where it's very stubborn and you aren't able to achieve a good result, then maybe you want to try the HR mode because you are using a much higher fluence, okay, at the same time. But just bear in mind, of course, if we compare all the three modes, this will be the most uncomfortable mode to use for the patients, okay? Because since we are delivering all the energy at one shot, so definitely the patients will feel more sensation from the treatment itself, okay? And the technique is very simple. You just need to do what we call the stamping method. So you just need to deliver one shot at one area, and then after that, you need to move on to the next area, okay? And you can overlap, but usually overlapping is recommended around 10 to 20%, okay? And we also have another handpiece, what we call the facial tips. So this facial tips is very easy to use, okay? This is an accessory where you just need to attach it to the handpiece, all right? And this is to treat those really hard to reach area, okay? For examples, like the ear or even the nostril, or if you have patients like with the unibrow, okay, where some areas you can't use the handpiece because the size of the crystal, sapphire crystal, is too big. All right, so you might be also burning other area which you do not want to do that. Then you can use these facial tips to treat them. The spot size is only 6 mm, so it's really small. Okay, so and we also have a protocol for facial tips itself. All right, so you just need to follow the skin types and select the fluence and the stack you want. Okay. All right, so so once after you have done the lasers, what you should see is actually just slight redness, which is erythema, and slight swelling, okay, or edema on the hair areas, okay? And of course, in some cases, you might get perifollicular erythema. Perifollicular erythema basically looks like, if you do not know, right, it looks like the patient has some kind of sensitive skin or allergy to the treatment, where they develops like a red small dots, okay, all over the skin, okay? And usually this redness, right, comes from the hair follicle itself. So this is not a side effect, or this is not something bad. In fact, this is what we call endpoint. Actually, we want to see that. And it doesn't happen to all patients. We say some cases is because usually we only see this in coarse hair patients. If it's a very fine hair, usually you won't be able to observe this kind of endpoint, because the coarser the hair, usually the more energy they absorb. So the more they react to the lasers, you will see there are more swelling and there's more redness around the follicles, okay? So like, I will repeat this because just now we have mentioned the number of sessions and the sessions interval. All right. So actually, I'm at the end of our presentations today. So this is just to summarize the systems, okay? So it's a very easy to use systems. And of course, we have one of the most versatile system as well, because you can use so many type of technique. You can use gliding, you can also stack, you can also just deliver one strong pulse if you like. And we have a very user-friendly interface where, like I say, almost anyone with just one short training, I think they can easily pick up the skill to actually use the systems, okay? And of course, it doesn't come with disposables at all. So it's very cost efficient systems, okay? So yeah, I guess that's all for my presentations. So is there any questions from our participants or anything that you would like to share? Because I see that we have quite a few users here. So anything that you would like to feedback to us or anything that you want Alma to improve on the systems, or maybe, any feedback from your patients in terms of the efficacies or anything, just feel free to let us know. Because this is a very small group today, so I guess we can have more interactions.
Yeah, I can see more of our audience also is the same clinic. So maybe can share about how they are using this Alma remove, right?
Anything that you would like to ask or share, or to just let us know. Anything, whether it's something positive, or
Yeah,
maybe if you don't like the system, you can let us know like what you don't like about it. So,
yeah.
oh, okay, we have one questions.
Mm-mm.
Oh, okay, for Zillian's hair removal, is there any special caution? Okay, for testicular areas. Of course, these are all very, very sensitive areas. Okay, so actually, just now there are some pre-treatment steps that I did not specifically mention, because earlier on this week, actually, we do have one fundamental sessions just talking about hair removal. But I think for this area, what we need to be very careful is that because it's a very sensitive skin. Okay, so make sure that before you treat your patients, always shave the hair. This is one thing very crucial. Sometimes we kind of like overlook this, okay? So we tend not to shave the hair, and then we leave left behind a lot of hair, or long hair even sometimes on the area. And actually bear in mind that when you are treating your hair, uh, besides the hair follicles that is going to absorb the light, some of the hair shaft on top is also absorbing the light at the same time. Okay, so when the hair shaft is absorbing the light, the treatment efficacy might drop. Okay, so that means your result might not be that good if you don't shave the hair. Okay, and of course, if you don't shave the hair also, because sometimes you might go over the same area over and over again, so there are chances that the hair on the top, it will burn, it will break. Okay, and it will stick on the skin. And if you're gliding on the area over and over again, there are very high chances that you will burn the skin. So I would say for any sensitive areas, like for testicular area, or even for ladies like the bikini line, okay, these areas you have to make sure that you really shave it nicely, okay, before you start treating. And of course, even pre or after treatments is also very important, especially if any male patients, right, they would like to go for some kind of uh, uh, not to say treatment, but let's say if they have the habit of going for saunas, or hot bath, all this, please ask them to avoid all these kind of activities after treating on all these sensitive areas, because the chances of damaging the skin and also the area around, I mean on the treatment area, can actually cause irreversible complication to happen. All right. And then we have, I hope I answered to your questions, okay, on what are the special thing that we have to take note. All right. And many will ask, does this laser have a possibility to affect the spermatic count? No, right? Um, I will say, actually, right, what we are targeting here is only in the dermal area, okay? So it's actually not that deep. So by right, it shouldn't have any effect on the sperm count and things like that. But however, I will say you still have to use with cautious, okay? Because let's say if you are using too much energy, all right, or there is too much of heat lingering around the skin. This is why I say after the treatments, they have to avoid any things that create too much of heat on the area, because we know that actually too much of heat, right, can actually cause lower sperm count, all right? So if they do not take care properly after the treatments, or even during the treatment, if you are not using the right setting, okay, too much of heat on the skin, then I will say it might have the possibility to affect. But however, if you are using it according to guideline and things like that, I would say usually, yeah, they wouldn't be any risk, or I would say there is very low risk lah, of damaging, yeah, the sperm counts, okay? All right, and another questions, for nostril hair removal, how much of reductions of hair is usually expected or targeted after 10 sessions? Okay, good questions. Basically for nostrils, right, I expect that a lot of patients are male especially, because I think males are the one that always have hairs always coming out from the nostril. But of course, some lady has it as well. So depending on the hair conditions, basically, because if the patient comes with a lot of fine hairs, I will say sometimes it is possible that it take more than 10 sessions. And because this is also a very, very sensitive area where you can't use too much of fluence or energies, okay, to destroy it. So technically saying that we usually tend to use very low energy to give more comfort to the patient. Therefore, because of the low energy, you might need more sessions as well. So I would say generally, I will tell patients be prepared, okay, for 10 sessions at least, okay. But let's say with coarser hair, then it might react very well. Then if you talk about how much of reductions, I would say generally it will give them at least, I would say 50%, all right? But it will really depends on how is the hair conditions that you start with. I think the coarser the hair, as a general, not just nostril, even other parts as well, they will probably get a better clearance and higher percentage of reductions. While for finer hair, usually the clearance is lesser. Usually sometimes some area even only maybe about 30-40%. Okay, but if they come with a coarse hair, like usually on the bikini line, on the underarm, right, it can give very good reductions of up to 70-80%. Okay, so I hope I answer your questions. Okay. And we had a case, okay, your question is, we had a case who really keen to remove nostril hair, really cost. We use facial tips to administer energy, but a few initial sessions, we note that there is a piece of semi-hard crusting formation at the inner nose wall that will eventually fall off after a few weeks. Patient didn't complain about it, but okay. Uh, I I'm guessing, okay, I'm guessing lah, probably because the nostril area, I'm not sure if it's really clean, or there is maybe any residual in the area, because just like other area, like our body, if you're treating on the face, or if you're treating on the arm, legs, or wherever, okay, if you did not clean the area properly, okay, especially the nostril, uh, is possibility that you can easily burn anything on the epidermal area, okay, and that will form a crust, okay. So I guess most probably this crust come from any residuals that's on the nostril. So I guess you really have to clean it very properly before we start treating it, okay. And another reason, it also could be due to the energies that you are using. I suspect that is it possible that maybe the energy is a little bit too high for these patients, so that, yeah, it form some kind of crust after that. because we are damaging a little bit too much of the skins already, okay? Because by right, usually there shouldn't be any crust that is formed unless the skin is not clean or if it's too dry. But I guess nostril area usually is not dry unless they have a lot of the dry snot on it, okay, where you didn't clean properly. All right. And yeah, so I guess most of the time is just cleaning the nostril area and make sure that the fluents you use are not too high. If in case you already clean it very properly, maybe try to reduce the fluents a little bit and see if you still get the same endpoint, okay? If you, let's say, still get the same endpoint, then maybe you can contact us. But at the same time also, maybe I will inquire Alma as well, because I think they have treated more patients than us. So probably they can also give us, some idea on what we can do to prevent this, okay? So you mentioned that the crust is only after laser, okay? And you use a wet cotton bud to clean is sufficient? Yeah, usually I think it's sufficient, okay? As long as you make sure there's nothing left behind in the nostrils, then I think it should be all right. Then let it dry off before. Yes, please let it dry, okay? Don't treat on a wet skin because actually our lasers, right, they can be scattered or reflected. I think I mentioned also, if you join us during the earlier section, I did mention about actually there are a few reactions that can happen when the laser is being emitted to the skin, okay? What we want is a laser to be absorbed, but sometimes it can be scattered and it also can be reflected. So when all this kind of unwanted reaction happen, it can cause the efficacy of the treatments, okay? So make sure wherever you treat, the skin is dry, okay, before you put on any gels or anything like that. Okay, I guess the sensation also make they have a bit of nasal secretion, so possible is the residual. Yes, yes. So I'm guessing maybe you have some residual in the nostril area. This is why. And yeah, the setting has always been discussed with Alma team for this case. Good, good. So I guess you also have contacted the Alma team as well for this. So I hope they also, yeah, able to give you a good answer, okay, on this case. But I guess maybe before you give up, try again, like I say, maybe, yeah, use a lesser settings and make sure, I guess it's more on the pre-treatments preparations. Probably you just have to prepare them well before you treat them again, okay? Yeah, please, if you have anything, let me know. We can speak in Cantonese, Mandarin.
Malay.
Not Tamil lah, okay? Not Tamil, I can't speak Tamil. 華語 OK 的，廣東話都 OK 嘅。
Yeah,
So,
we're waiting. Still got another.
yeah, can.
Can, no problem. Can wait.
Jenny 有问题吗？
嗯，
其实你们不要 type 哦，也可以，只是直接这样问的，我们 casual 一点，
对，
不用这样 formal 的。今天星期五了，可以 relax 一点。
我的顾客是之前我已经问过你们的人2次了啦。我的顾客是做脸的 hair removal，然后他已经 complete 了12次。Then after 1 month 过后，他回来的时候，他有一些 part 的毛发是变粗了。
变粗了。
对。
OK。
然后他回来。Then 我有问过你们的人，就是换另外一个 setting for 他，但是那个 setting 是那个 HR 就是最强的那个。
OK。
然后做了第1次、第2次，他的 feedback 是 OK。Then after that 第3个 treatment 开始的时候，他还是觉得开始别的地方又长出毛。
别的地方就是不是用 HR 来做的地方吗？
一样，我都是用 HR。
哦，你讲别的地方变粗了，就是
他一开始进来的时候是一个 part for 变粗，但是其余的地方我还是做回同样的 setting。OK。然后2次过后，第3次回来的时候，他就觉得别的地方开始又有同个问题，就是出毛。
就是因为别的地方你暂时是没有用过 HR 啦，只是用其他的 mode 来做啦，对吗？
一样，他开始回来讲有一个 part 出毛的时候，我就已经开始用 HR 了。
哦，开始用 HR。
对对，
so 你的问题是就是讲
这个是一个外国人，我 inspect 他的 hair follicle 了，因为他总共做了差不多17次。
哇，这样多
First phase 他 improve，then after that 他回来，他讲他的侧脸啊有 patchy，让我们看有毛发啦，是粗的毛发，所以我们就在叫他，可能你要做多5次，5次回来，他还是觉得这么我做这么多次还是不能除掉，then 我们就用那个放大镜 inspect 他的毛发，他是他的毛发是 dark brown to black 的，不是阿毛狼的浅色的。所以我们呢是跟他讲，是不是 maybe 我们要给你的 hair cycle 多一点时间，顺行做了17次这样子，我们现在是拖延他2到3个月。的时候就希望他的 melanin pigment 在下面可以 collect 多一点的时候，我们 deliver 那个 energy 可能对他讲会比较有效 ，because 那个 energy 比较集中。但我们不知道啦，因为这个是一个还没有解决的 case。
你们前面是隔几久啊？帮他做的时候是1个月，
1个月1次
，1个月1次啦。OK，我是觉得啦，
因为他在来我这边做 treatment 的之前，他有去做过别的 hair removal，效果是 OK 的。然后他长回来，他才找到我们。
其他的 part OK 的，其他 part 有效果，只是那个脸那边其他 part so far Brazilian。
他有做比基尼，但是他比基尼的效果是 OK，只是他的脸的毛发为什么会这样？
了解。OK， 这样的情况哦，有时候其实那个毛长回来更粗啦，我们通常是怀疑是那个 setting 可能是不适合它。OK， 不管那个 setting 是高还是低啦，其实我们有一些paper 的，就是一些 clinical study 的，其实也不只是 Alma 一个 laser， 其实很多其他的 laser in the market 也是有这样的情况的，是如果我们用的 setting 不适合那一个 skin 它有可能是反而是反效果，就是反而它不是更优，它是更粗。所以如果你讲那个 patient 它的毛长回来是更粗的话，这样我就是肯定会建议你不要再用之前的 setting， 肯定要改那个 setting，OK？可是有时候改也未必是一定要用更高，因为坦白讲不适合的 setting 就是讲有时候不一定讲你要用越来越高才是 target 到，反正有些毛可能它很粗，你用太高，反而它的反应是反效果的，所以有时候反而你们需要调的是调它低一点点。OK，so that 给它那个 absorption 是刚刚好。OK， 因为如果太高或者太低的话，其实也有可能是可以 overstimulate 那个 hair 的，弄到它会长得更多。All right，
这个 machine 科是会引致长得更粗的吗？
其实不只是 Alma remove，OK， 不只是 Alma 这件。
So there's a possibility 弄到它长得更粗。
对 ，there is a possibility。不只是我为什么 emphasize 不只是 Alma， 因为其实我们也不只是卖 Alma remove， 我们也是有卖其他的 brand 的嘛。所以在其他的 brand 也是有同一样的情况发生的，就是讲这个不关 machine 的事，其实基本上是那个 patient 的 hair condition 的事 ，OK， 所以有时候就是可能有些 setting 不适合他，就刚刚好你用到那个 setting 不适合他的时候就反而会有这样的反效果。所以如果你们 try 了那个 setting， 你发觉到它还是有这样的情况 ，maybe 你可以 experiment 一下，如果你再用高都不行的话 ，maybe 你可以用 HR mode， 还是 HR mode to touch up。But 你用再低一点点的 energy for 它，就是 maybe 之前你是用 for skin type， example 你讲它是按摩嘛，你可能是用一个 skin type 2的 ，maybe 你可以 try 一下用 skin type 3的 setting 这样给它，就低一点点罢了。maybe 你只是需要 reduce 那个 fluence 大概10% 这样，然后你看一下它的反应是怎样 ，OK？ 因为这样的 cases 我们也是有 encounter 过，但坦白讲啦，不是在 Alma remove 啦，是在其他的 machine 啦，我有看过这样的情况的。所以很多时候他们换一换 setting，其实那个效果是会更好的。Maybe 你要 try 一下。
如果毛长回来，如果 hair 是稍微开始有一点 grey 了，但是还有 melanin， 除了过后这1 year 毛长回来，也是就是 decrease melanin 的 whatever 它的 color 对吗？
你讲 after 他做了，现在他的毛是变浅了吗？
不是这个顾客，我是讲，有一些人他们开始 maybe 30多、40多已经开始有 graying of hair 了的，但是还可以吸收啦，不是完全白。过后我们除了过后再长回来，也是就是那一个阶段的毛发的颜色，对吗？
对对对，我们不可能帮他
不
弄到那个
能，它就是
melanin
跟着它
回来
的里面的 melanin 啊。
对
OK
对对，它还是会那个颜色的。只是坦白讲啦，如果你有 gray hair 的 patient 哦，真的要 set 它的 treatment，那一个 treatment 哦，大多数啦，它的 result 不会讲那个 clearance 很好的，很多时候都是 below 50% 的，因为它吸收那个光不是很好的，所以那个 result 通常都是 clearance 只是可能是 maybe。最多也是30-40% 这样罢了的，还是会有 hair 长回来的。
也是做1 month 啦，mean 4 to 6。
可是一样的，他们的 hair
也是要
cycle
4 to
是一样的，
6
也是4 to 6的。OK，so 我刚刚看到你们还有问是 difference between Alma Beauty and
我问的这些问题都是比较 commonly inquiry 会问到的。
OK，
我给我的 staff 听一下。
I see，OK，其实除了它的 wavelength 跟它 hand pieces 那些呢，OK，and 2 years newer， 其实 new 跟 old 也没有什么大分别啦，坦白讲，两个都是 diode， 只是因为soprano 它是 higher end 那一个 model 来的，所以其实它是比较 versatile，that's what I can say 啦，就是讲它里面的 setting parameters 那些是比较wide 一点，所以很坦白讲啦，如果你发现到 Alma Beauty remove 真的是有一点点 limitation on your patient 啦，maybe it's also time to think about an upgrade 这个是 reality 啦，因为它的 setting compare to soprano 啦，都可能会有一点点 limitation 的，就是讲它的 setting 没有soprano 那么 wide，soprano 它会比 remove 多一点 setting。所以你可以玩的东西在 soprano 里面是多很多的，其实所以如果有些 tough cases， 好像你们刚刚讲那几个so maybe 有时候你可能需要一些不一样的 setting， 或者是不一样的 hand pieces 来帮助你们去 treat 他们的。This is why also Alma Soprano 是比 Alma Beauty Remove 贵很多啦，因为它是一个higher end versions 来的。希望我答到你的问题啦哈，还有什么问题吗？应该 hopefully 是咯，我解决到你们的暂时的问题 ，but anyway 我们也希望 after， 因为现在比较 tough 啦，我们 to visit 你们 ，and then 我们有一个 discussion 或者是 maybe 一些 further 的 training 这样 ，but hopefully after MCO 我们也是希望可以 maybe 跟 Sleep Clinic 那边做一个you know like discussions or maybe 我们有一些 activity together so that 我们 can learn from each other as well 啦 because since 你们也是用了那个 machine 那么久 so 我们也希望可以 get more feedback from 你们啦 so that 是咯because with more feedback only we can improve 啦 so 我们才知道还有什么问题的是你们常常遇到然后我们也是可以 get 就是 advice 啦 from Alma 那边 OK 我们才可以 come up with different improvement 啦好吗
So far 我们的 staff they are quite 可以 independently handle 那些 case so far 效果蛮不错就是几个这样子的我们都差不多已经问了 and they always in touch with the Alma team also
good
so thank you for the refresh and support
alright welcome 好那这样我们 keep in touch 吧
Okay.
Okay,
Stay safe. Thank you so much. Bye bye.
Okay, thanks everyone. Bye bye.
Bye.